now we're going to talk about another very common issue, a very common issue for the patients that I see in my office and a lot of practitioners in my field, low sexual desire. It strikes women all across the reproductive life cycle. And Dr. Lori Brotto is an expert in this field. She's a registered psychologist and associate professor of gynecology at the University of British Columbia. Hello, Dr. Brotto.
Hi there, Maureen. Thanks for having me on.
Oh, thanks for coming on. And if anyone has any questions for Dr. Brotto on this subject, the number to call is 604-280-9898 or star 9898 on your cell. So this is there's been lots of more recent research about low sexual desire in women. Can you actually define it for me?
Sure. So, well, there's, as you know, Maureen, there's many different terms that we hear throughout the media. One might talk about their lust or their interest in sex. Basically, it boils down to how motivated someone is in engaging in any kind of sexual activity.
And this low sexual desire, although it can strike men too, but it's quite common in women.
Yeah, so there have been a number of recent larger-scale studies. One very large American study that looked at about 31,000 women, and it found that when you look at women across the ages, that somewhere between 20 to 30% of women will say that they've been bothered by lack of interest in sex for at least a couple of months over the past year. Now, the issue is not all of those women are distressed by it. So what that means is that for not all of those women does it significantly interfere in their life or their relationship. So when you look at those numbers, it's probably around the 15% range of women who will say, yes, I'm really bothered by lack of interest in sex. It's getting in the way of my life and my relationship.
And this is women in their 20s, 30s, 40s, 50s, 60s, 70s?
Yeah, that's right. So the large studies have looked at women between the ages of 18 all the way through to 101. One thing I'm certainly seeing in my clinical practice is an increasing number of young women, in particular young women who might be trying to hold down a full-time job, having several kids, trying to do the volunteer work in their community, etc., and are absolutely and completely exhausted. And so yet they feel that they should be going to bed after the 11:30 news or after listening to your show and finding that lust for sex, and they're simply not finding it.
And fatigue is the number one reason, if I'm correct, for low sexual desire.
Yeah, fatigue is definitely a very, very common factor predicting low sexual desire. Of course, another really, really common one is your feelings for your partner. So it's not surprising that if you don't like your partner or if you're turned off by your partner, that you're probably not going to be motivated to have sex with that person.
That's right. Or if you're upset with your partner, you can have a short-term period of time where you're not interested in having sex with your partner if you're perhaps annoyed with him.
Yeah, that's true. And so certainly when I see women who come to see me in my clinical practice, I spend a lot of time just giving some basic education on here's some of the, kind of normal events of our lives that might lead to a change in how interested or motivated you are for sex. And so rather than jumping to find some kind of treatment or therapy or medication, we should start with some of those basic factors, like are you getting enough sleep? Are you eating well? Are you well hydrated? How's your relationship like? How are your feelings about yourself in general? What's your self-esteem like? Before we go on and to consider something more, say, intensive in the way of sex therapy.
Right. And one reason for low sexual desire may be anxiety. And I find a lot of patients of mine in my clinical practice will present with this anxiety, and they'll, if you ask them about their life, they'll just start, going on and about, and you can tell that they're on the ceiling basically, and they've got this going on and that going on, and then they may even break down, or they don't. Some people don't have the insight to realize that their lives are spinning out of control.
Yeah, that's true. And Maureen, as you know, there's also the anxiety about how they're performing in the bedroom. And I see a lot of women who will be very concerned about their own performance. If a woman's having trouble reaching orgasm, she's focused on that. She's worried about maybe what her partner is thinking in the act, and all of that serves to actually interfere with her sexual response even more.
And this can happen in even longer term relationships, not necessarily a new relationship where somebody may be concerned about their performance.
That's very true.
Or
yes.
their body size.
Exactly.
Or their shape.
All of the above, and the list is very long.
The list is long, and there has been a number of drug companies have are seeking the female Viagra, if you will. But that's a very difficult pill to swallow, no pun intended, because it's actually not. It's really not necessarily about a pill, and some of the research you've done shows that demonstrates that.
Yeah, so there have been quite a number of different medications that have been pretty aggressively studied. They've gone to the regulatory bodies for approval, and to date in 2013, there's no approved medication for treatment of a really, really common problem, and that is the problem of lack of interest in sex. But that certainly does not stop researchers and drug companies from investing millions, if not billions, of dollars into studying and trying to find a pill that might improve things, just like Viagra has been very, very useful for men.
That's right, and also the genital arousal, the blood flow to the genital area in women. Can actually increase, and things can seem fine down there, but the woman there's still a disparity between her desire for sex and her response to sex.
That's right. Yeah. So that's a really important point you're making, Maureen, in that there's no blood test. There's no physical or physiological exam that a woman would be able to get in order to tell her physician, tell her sex therapist that she has a sexual dysfunction. It really all boils down to, how is she feeling in her head? How does she describe her sexual motivation?
Exactly. And so there are so many factors that come into play that people would have to take miracle pills all day long, perhaps, to deal with the family, the relationships, the fatigue, any medical condition that somebody may have. Thyroid disease may contribute to low sexual desire in women.
That's right.
And so a medical exam is an important, or a good physical exam is an important aspect for anybody suffering this. And the other thing, it's a big secret, isn't it? We don't talk about our friends, and we don't talk to our friends about how little sex we're having, or some people may just be quiet or may exaggerate how much sex they're having.
That's right, and I would say probably, close to half of the patients that come to see me wanting treatment for sexual problems, I end up not seeing them much more than 1 or 2 sessions, and it's because after giving them some basic education, replacing some of their myths with accurate information, they go home, they make a few adjustments, and they're totally fine. And it's because of what you've described. It's a topic that still to date we have a real hard time talking about it, and there's a lot of discomfort, and there's also a lot of myths floating around thanks to popular TV shows that portray how women should be responding, and it's just not the reality for the vast majority of women.
That's right. And one of the most common things that I see in my practice is, and they're largely women in their 50s and 60s and 70s, but sometimes in the 40s as well, they will say, if I never have sex again, it will be too soon. Mm-hmm. I never want to have sex again, or, that I got rid of that man and that's it. I never want another one. And it also, this is not limited to heterosexual couples. Low sexual desire occurs with same-sex couples as well.
Yeah, it sure does. The studies that have looked at women who are in relationships with women or bisexual women find that rates of low desire are really not all that different from women who are in heterosexual relationships.
Exactly. And it's a very common issue, and as you say, if you're bothered by it, then it is a problem for you. I'd like you to hang on the line with us, Dr. Brotto, and when we come back, we're going to talk about some of the mindfulness cognitive behavioral therapy that you have to treat this sexual dysfunction. And I'm Maureen McGrath, and you're listening to the CKNW Sunday Night Sex Show. Welcome back. Dr. Laurie Brotto, a registered psychologist and associate professor of gynecology at UBC and one of the premier sex researchers in our city and Canada and perhaps the world, dare I say, has joined me tonight. I did want to read an email, Dr. Brotto, that I got, which underscores what can happen in a relationship when a woman has low sexual desire. Dear Maureen, can one get genital herpes from receiving covered oral man from female escort? Though she never used her mouth anywhere else other than the condom, The condom covered the penis. How long should I wait to have sex with my wife to be on the safe side? It has already been 4 weeks. Please don't use my name on the radio. Okay, I won't. But this is a typical example. It's not uncommon because men are hardwired quite differently with regard to sexual health. So affairs can often be the result of low sexual desire in a relationship. Dr. Brotto.
Yeah, that's true, and I mean, there's an interesting phenomenon that even someone with low sexual desire with a new partner, they might find that sexual desire that they're yearning for, that they're missing, that maybe they had in the early stages of a relationship. And so, for some people, certainly not for all, but for some people, low sexual desire can lead them to test it out on other relationships and ask questions about, is this me? Is this a relationship? So you're absolutely right.
Yeah, and I just want to say that a condom isn't necessarily 100% protection from sexually transmitted infections with regard to that email. So you do some mindfulness cognitive behavioral therapy in your clinic.
That's right, I do.
So
I
tell
do
me,
a lot of it.
Yeah, and it's fantastic. So tell me, how does that work as the treatment for sexual dysfunction and low sexual desire?
Okay, so mindfulness meditation, as you know, has a really long history in the Eastern world. And probably about 35 years ago, pain researchers actually introduced it into Western medicine as a treatment for people who were suffering from long-term chronic pain and who were really not benefiting from any of the other medical or surgical treatments. And so there's been now at least 3 decades of research that's taken mindfulness and applied it to just a host of different psychological problems like anxiety and depression, problems with attention deficit, hyperactivity disorder, etc., and as well as a number of medical problems, heart disease, irritable bowel syndrome, etc., etc. So about 10 years ago, when I was finishing off my training at the University of Washington, I was actually trained in mindfulness meditation, which in a one-sentence summary is essentially the practice of training your attention to be focused on a specific target. So it's the ability to be very much in the present moment, watching what's happening as the sensations are unfolding. So, for example, if you're focusing on your body, you're paying very close attention to the body sensations and how they're changing, and you're doing all of this non-judgmentally. So, for example, if you're paying attention to the sensations in your knee, you're describing maybe some of the vibrating, some of the pulsing, some of the movements that you feel, but you're not blaming yourself, you're not putting yourself down, you're not saying, ouch, that hurts, what's happening, et cetera, et cetera. So around 10 years or so ago, when I was trained in this modality for a completely different non-sex-related treatment, and at the same time I was doing a lot of sex therapy, listening to the stories of the women that I was working with, they really described their sexual response in a way that suggested that their minds were really not in the present moment. So their bodies may have been, they may have described genital pulsing and some wetness, but their minds were elsewhere. So, for example, they might be saying that they were thinking about their shopping list or what they were going to make for dinner.
Or watching TV.
Or counting ceiling cracks, et cetera, et cetera. So, really a clear example of the mind and the body not in unison with one another. And so I sort of brought this question to my supervisor and said, hey, wouldn't this be almost the perfect population in which to apply mindfulness? And so we did some experimenting. We pilot tested it on some patients. And now, about 12 years later, we've published a large number of studies. We've been thankfully quite successful with getting some federal grant money to study this, and we've applied it now to a variety of different populations of women, and we're starting to do so with men as well. So although the research is still in its kind of early stages, there is certainly evidence that practicing mindfulness meditation can be quite useful for improving a woman's motivation for sex.
And that's during sex, that's during intercourse.
Well, no. Actually, our program has women practice it first of all, having them practice it in their non-sexual environment. So getting them into a good mindfulness practice, and then once they feel quite comfortable with what it actually entails, we then have them practice in the more sexual scenario.
So they're trained. They're trained first on the practice.
That's exactly right.
And then they go back to the bedroom and
That's
then and apply it. And so while they're in the moment, shall we say, they're actually thinking about what. Well, you tell me, what exactly are they thinking about?
So, for example, they might be focusing on how their body is responding. They might be paying much closer attention to some of those changes in their body and specifically their genitals that really, for the most part, a lot of women don't pay any attention at all to. So, unlike men, where when a man has even the early stages of an erection, he knows almost immediately. For women, women are really out of touch with when their body is aroused, unless they put their hand there and they get that kind of direct feedback about some wetness. So with mindfulness practice, women are much more in tune with the early signs of arousal, which then makes their minds feel more aroused, their body is responding, and you get into this nice, positive cycle where as the body becomes more aroused and the mind's tuning into it, that in turn fuels more of the body's arousal and her enjoyment of what's happening.
And is that in line with the responsive desire?
Exactly, yeah. So during sexual activity and afterwards, women will make statements such as, even if I didn't have desire at the beginning, I found that as the encounter was unfolding and I'm very present and I'm tuned in and I'm paying attention, that I now have desire for what's happening.
Right, at that time. Because a lot of women will say, I just have no desire to do it with him. And then I'll say, well, once you are doing it, and women do it for a number of reasons. They engage in sexual intercourse to decrease the negative response from a partner, or for shoes, a number of reasons, just because they feel guilty, but I'll say, well, once you're engaged in it and once you start, are you enjoying it? And then they'll say, yes, they are.
That's right. And so with mindfulness, we find that the more that a woman can guide her attention away from all the distractions and all the judgments and all the things on her to-do list and all the memories of when sex was bad, and if she can actually focus on what's happening in the here and now, that she's more likely to go to that place and say, wow, now I'm in the mood, even though I wasn't at the beginning.
Right. And how much do you think socialization of young women has to do with this? So we don't necessarily teach women about pleasure and about that it's okay. There are certain groups or cultures that teach about pleasing the man, or that it's sex is for men.
Yeah, I mean, this comes back to what we were talking about earlier, in that I think for a lot of women, some basic education on norms, on the influence of culture, on myths, on socialization, on the expectations that not only culture places on us, but that women place on themselves, really can set the stage for sexual unhappiness, and that's really the place to start.
And one of the biggest myths is experiencing orgasm, and that 70% of women require clitoral stimulation to experience orgasm.
That's right.
And that's a big goal for a lot of couples, is to have simultaneous orgasm, but it's not necessarily going to happen given the time period, the time difference, and the desire the discrepancy between men and women.
That's right. Yeah, and it also, unfortunately, is often the goal of a lot of males in the heterosexual couples that I see, although not necessarily the woman. Women will often say, whether I have an orgasm or not, that's really not going to determine whether the sex was enjoyable for me. Mm-hmm. Whereas many men might say, well, if you didn't have an orgasm, then it wasn't worth it. We should try again until you do reach an orgasm. And then some couples can get into this kind of vicious spiral going downwards. And so, again, that's where some basic education on what men and women might get out of a sexual encounter might be quite different.
Exactly. It's quite different. And also painful sex, which can happen at the menopause, can lead to low sexual desire. But we're going to talk more about, you're going to come back next week and talk more about vulvodynia and some of your other studies. Do you want to give me your website, Dr. Brotto?
Sure. I'll say it twice.
Okay.
It's rather long. So it's obgyn.ubc.ca/sexual sexual health. So obgyn.ubc.ca/sexual health. If not, people can just Google my name, and that should take you to our website.
Okay, wonderful. Thank you so much, Dr. Brotto. So much information. We look forward to having you back next week.
Thanks a lot for having me, Maureen. It was a pleasure.
Oh, you're welcome.